The coronavirus pandemic is sending many countries around the world into lockdown and putting immense pressure on their healthcare systems. So how are different parts of the world dealing with this global crisis? Hello and welcome to Bigger Than Five with me, Rida Fakhri. The World Health Organization says the coronavirus pandemic is accelerating. The Director General of the organization said it took the world 67 days to reach the first 100,000 cases, 11 days for the second 100,000, and just 4 days for the next 100,000 cases. Now, the rapid spread has put many countries' healthcare systems on the verge of collapse. We now hear from two doctors at the center of the crisis in Milan.
Hello, I am an intensivist and I work in a small private hospital in the city center of Milan. The situation regarding the new coronavirus pandemic here in Italy and especially in Lombardy is a very critical situation. The number of patients who get ill is increasing by the day at an alarmingly accelerating rate. We have huge logistical problems in organizing new wards in order to do the best in accepting these patients. We haven't got all the devices, we lack drugs, we especially lack personal protective equipment, and this sometimes makes also it risky for the health workers to assist the patients.
I myself work in a hospital. I'm in the psychiatric ward, but I have friends working in the ER, in the ICU units, and they're doing 12, 14-hour shifts so that they don't waste gloves, masks, gowns. They can't take breaks because that would imply getting undressed and redressing with new material, and they can't afford that right now. There's not enough beds for everyone and in the ICUs, so they're building new temporary hospitals as fast as they can, but that's still not enough, and unfortunately they have to often choose who to put in the ICU and who stays out according to who has more survival chances. The worst part is that if you get sick, you're brought to a hospital, and there you're completely isolated from the rest of the world. Your loved ones don't know anything about you. You don't know anything about them because the hospitals are collapsing. There are huge numbers of patients coming in every day, and doctors don't have time to update relatives who have to stay away not to get infected themselves. So there's many cases, all cases of people dying alone, with relatives knowing nothing about them, not one last hug, not one last word. And this is extremely difficult.
For more on the global response to this growing pandemic, I'm now joined by Dr. David Nabarro, WHO Special Envoy on COVID-19. He's also Chair of Global Health at Imperial College London. Dr. Nabarro, you said recently that the coronavirus is more serious than previous outbreaks of Ebola and SARS in terms of potential impact, but you also said it is more soluble than some of the others. How do you assess the overall global response to this pandemic, and what makes you so optimistic?
Thank you. The pandemic of coronavirus is advancing in a very rapid way. It's accelerating. It's what we call an exponential challenge because each week it increases in size as many as 8 times because of the transmissibility of the virus that causes the disease. It's expanding all over the world, and what we see now is just about every country experiencing some degree of challenge because of the virus. The response is really very good because what we're seeing is also that governments have realized that they can contain and suppress outbreaks of the disease, but it requires an enormous effort with multiple groups working together in a consistent way. And that's a challenge in some places. And our job is to try to encourage more consistent and effective action everywhere.
You say the response is very good, but you recently criticized the response of some Western leaders, besides the American president, who initially likened it to the common flu and said it would simply disappear. Who else did you have in mind? Which of the countries did you have in mind in terms of too lax of a response to this?
I try not to pick out individual countries. Each leader has to navigate some very difficult political issues when deciding how best to respond. But from the World Health Organization's perspective, the most important requirement is that everybody everywhere is on the alert for cases of the disease, and when they appear, people are helped to identify the challenge and to get isolated. Because what we have to do everywhere is to break the chains of transmission, and that's how we suppress outbreaks as they occur.
And some governments have responded more quickly and more efficiently than others. Could the WHO, though, have done more by sounding the alarm bells earlier, by calling this a pandemic earlier than it did? You waited until about 100 countries were in fact infected. You waited until the 11th of March to call this a pandemic, when many people would simply have seen the writing on the wall.
This was declared as a public health emergency of international concern early in February. That's the highest alert that the World Health Organization can give to the world. The term pandemic was then introduced when it was clear that the disease was absolutely everywhere, and it was announced to signal the need for an ever greater ramping up of response. The reason why we've had to do this is simply because for many countries, putting in place quite strong actions to reduce transmission and to reduce the opportunities for people to get the disease is very difficult when you've only got a few people with symptoms of the disease.
But do you think
That's
it could
why
have
it's a
spurred
challenge.
more governments into action earlier on? I know you're also co-chair of Global Health at the Imperial College London. And as you know, the recent study that was put out has actually spurred some governments, many would argue, including the British and the American, to do more and take this more seriously, because the suggestion was that this pandemic could actually leave millions of people dead.
Yes, you're right. And I think that helping governments to understand the severity of the challenge has been very much on top of mind for the WHO, World Health Organization Director General, since he first realized how serious it was in January. But you have to remember that each government needs to make its own choice. Some governments have followed the experience of China, South Korea, and also Japan in mounting very vigorous and active responses quite early on. Other governments, for their own reasons, have been slower. But the reason why I'm generally satisfied at the moment is an increasing number of governments have now come to realize that urgent action is needed now.
But how effective, though? How effective is it for governments to shut down their borders and all travel when clearly this virus is spreading very fast among nations, within a country's own borders? How effective can it be if virtually every country, in what seems to be a knee-jerk reaction, closes off all of its borders? Is that going to be enough?
The important requirement is that at every community in every country, we have people organized to identify the disease and encourage quick isolation. That is the bedrock of control. Then the second requirement is to encourage people to maintain physical distance from each other, 2 meters. And that physical distancing is made more likely if the government can also close down parts of the economy. The closing of borders is an additional factor. It's not the primary means for control. And that's why I'm focusing all the time, and I'll say it again and again, it's interrupting transmission that is the primary purpose of all control efforts.
In the case of China, it was the epicenter, Wuhan, that was completely quarantined for over 3 months with some clear results. Is that a measure that you would suggest needs to be taken by some governments?
The Chinese experience suggested that 4 things are necessary. The first is people everywhere need to know what's happening and need to be part of the response. Secondly, there has to be community level healthcare to help people to know when they're ill and to enable them to be isolated. Third, very importantly, hospitals have to be repurposed so that they're ready to receive an influx of people with COVID-19. And the fourth is that the whole of government has to be focused on the pandemic. China has shown the rest of the world steps that can be taken in order to get on top of it. And using that Chinese example is what I'd like every country to follow.
How central is the issue of testing? Because it's all well and good to hear the Director General of WHO say test, test, test. But in reality, is this the response, or is this a mere slogan, given the fact that many countries don't have the capabilities or political will to test?
We've seen from South Korea that if you include widespread testing as part of your response, it's much easier to break chains of transmission. People know where the virus is, they know whether they're infected, and it's then possible for them to isolate and isolate fully. The fact that there is not widespread testing going on is a frustration. And of course, one part of that is access to tests, but the second is whether or not governments can get organized to do it. And the WHO Director General is saying test, test, test is not a slogan. It's an absolute request to all countries to raise the priority they give to testing, because controlling without testing, breaking chains of transmission without testing is possible, but it's more difficult.
Dr. David Nabarro, thank you so much for joining us.
Thank you.
Now, while most countries are experiencing an exponential growth in the number of confirmed COVID-19 cases, one country that managed to contain the virus is South Korea. During the peak of the spread, South Korea identified more than 900 cases in a single day. Within a week, the country was able to reduce the number by half. 4 days later, they halved that number again, and then again the following day. So how did South Korea succeed in containing the virus? Joining us now to talk about this is Dr. Jerome Kim, the Director General of the International Vaccine Institute in Seoul. So one country, Dr. Kim, that really has stood out from the rest is South Korea. In fact, the Director General of the World Health Organization said that the rest of the world should heed the example of South Korea and apply some of the lessons learned. What are the main lessons that you think the rest of the world should apply?
I think they make a lot of sense, and you've been hearing countries around the world talking about how they would like to implement these various steps. I think probably one of the most important things was that they had been through this exercise before, at least once during the MERS crisis, and then as a result of the MERS crisis, they had several preparatory drills to get up to speed and make sure that they were able to respond. I mean, nothing helps better than preparedness. Of course, every epidemic is different, so preparing for the last epidemic doesn't necessarily prepare you for the current one. I think really importantly, their decisions were decisive. They made them clear. They were based on data, and they were made kind of openly and transparently. The government tried to relay information as promptly as it could and make the reasons for its decisions known to everybody.
But how central to all this was the aggressive testing that was implemented, that South Korea was able to get to the bottom of the source of infection, to know exactly who was infected, and then take the appropriate measures?
So I think, aggressive testing is definitely a part of it. And, having the kits available was also a very important part of it. And part of that is the way, the South Korean biotechnology industry is structured, and the way the ministry had prepared for the kits and then was ready and able to review their effectiveness, their sensitivity, their specificity, and rapidly approve them. That allowed these companies that were making the kits to rapidly expand production. And that was one of the critical aspects of this, test, isolate, treat the people who had to be treated, track the people who might have been exposed and test them or isolate them to keep them the infection from spreading. So I think all of those were part of an important response.
So you say that the South Koreans were primed to treat this as a national emergency and take the decisive actions that they did because they'd been through another outbreak of coronavirus, MERS. But 8 years on, I know that your institute has been dealing with all sorts of infectious diseases and trying to come up with vaccines to address them, from tuberculosis to MERS. But 8 years on, there still isn't a vaccine for MERS. So how realistic is it that we'll see a vaccine for this new coronavirus pandemic anytime soon, in the next 18 months or less?
So there is a big difference between this infection and MERS. I mean, MERS, while it has a much higher mortality, has a much lower level of transmissibility. This epidemic is not only spreading from China to South Korea, but then to Europe and North America And you've seen the numbers of spread in North America, even in a city like New York. So that's a very important thing, and that will drive companies, a huge number of companies, to try and make an investment in a COVID-19 vaccine. If you were to ask me in normal times how long it would take to make a vaccine, I would say, well, usually the big companies tell us 5 to 10 years. This is different.
This is different, and as you say, it perhaps cannot be compared to SARS. The mortality rate was, with SARS, which broke out 8 years ago, 34%, according to the World Health Organization. Ebola's first outbreak was over 50 years ago, and the vaccine was just okayed by the FDA just this past December. So do you think there is the incentive now for private companies and governments to put all their efforts in turning out a vaccine that is safe and ready to use in a short period of time for this one?
So I think that the big difference here is, SARS in the early 2000s and MERS, which happened in South Korea in 2015, were much more limited in scope. This is an epidemic that is spreading in a major way across both middle and low-income countries as well as high-income countries. And that in and of itself will drive activity. Governments are very worried, and that also drives research activity in vaccines. So, from the 5 to 10 year normal, we're looking at maybe 12 to 18 months to the proof that the vaccine works.
And how,
that is actually remarkable.
Right, but how resilient is this novel coronavirus when you compare it to others? Can it be treated in any way without a vaccine? Can it be stopped without a vaccine?
So right now, there isn't an approved drug. The only thing we can do is really supportive. I think Dr. Fauci and others have made the point that there are some drugs out there that may work, but it is really important to test them in trials where you compare them against placebo or against other substances that are known to work. And of course, there aren't any. And the reason for that is, if you think about 100 people who have the infection, 80% will have very minimal symptoms, and maybe 2% will die. And that means that 98% of people will get better on their own. So really the question will be, if you start a person on a drug, will it prevent progression to more severe disease that requires hospitalization, which would be great for our healthcare system? Will it prevent death, which would be great for the people, unfortunate people who are infected? But you really have to compare it against placebo. So, chasing after the latest thing just because it looked good in a test tube is not necessarily the way to pursue something that actually works against the disease.
But until we're sure that a vaccine does work and is safe to be tested and used and distributed to a wide swath of the populations around the world, can we return to normal life? Or do you think we need to stay under lockdown, as it seems to be now, the way most governments are doing this, until a vaccine is ready to be used?
So I think it will be difficult to sustain lockdown for very extended periods of time. I mean, I think many people are looking at the state of the economy as lockdown progresses. The decision to release a country or a city from lockdown is really going to depend on the data and the data that are presented to the people who are making decisions. A vaccine offers one of the best hopes for return to normalcy, and if that's the goal, the end that we have in mind, then we have to progress towards it. And in the meantime, consider all these other things. For instance, the suppression doesn't end the epidemic. It draws it out. But that isn't a very critical thing, because if we delay people having to go on respirators or ventilators or use up hospital bed space, then the medical resources that are available to take care of people when they get sick will be more prepared or present and available.
All right, Dr. Jerome Kim, thank you very much indeed for joining us. We now turn to Africa, where many countries have had confirmed cases of COVID-19. While the numbers are still low compared to areas in Europe or Asia or the United States, countries are imposing a range of prevention measures to contain the spread of the virus. To discuss the situation across the African continent, I'm now joined by Dr. Michelliao, the World Health Organization's Program Manager for Emergency Response in Africa. He joins us from Brazzaville in the Republic of Congo. Dr. Yao, what is the situation on the ground where you are and across other parts of the African continent? How are countries in sub-Saharan Africa dealing with this new pandemic?
The situation is getting of major concern. We had a few weeks ago sporadic cases that were imported cases in many of these African countries. But the last week, we reached the bar of 100 cases per day. And since Sunday, we are around 200 cases per day. The major concern is also that after these sporadic cases, we are now facing local transmission, including also high risk for community transmission in some of the countries. We have a worrying number coming from countries like South Africa, as well as Algeria. So this is the major concern, having a community sustained transmission that will exceed the response capacity in terms of health services, mainly services to deal with critical cases.
And are countries able to detect the spread of this virus early? Do they have enough testing capabilities?
The testing capacity is limited. They can test few cases, like the idea is for countries to confirm the first cases. We were planning a second batch of reagents, but we are already facing challenges related to the logistic constraint related to all this restriction of movement as well as travel ban in many of these countries. It's why since last year we were kind of raising this concern to the stakeholders. We have to be careful while having public health measures to ensure that also the response still goes on. We need to supply for laboratory, also for protective equipment for health workers, and we need also to prepare for the next phase. The next phase could be a wide community transmission that requires extension of treatment capacity, and all these require support, logistic support for that.
And how much of a strain is this coronavirus putting on the existing efforts to combat Ebola, which has been around for at least 5 decades and which is seeing constant flare-ups in countries like the DRC, the Democratic Republic of the Congo? Last year alone, there were more than 2,200 deaths.
We are lucky that we had Corona when we start the countdown to declare the Ebola outbreak over in DRC. We have 21 days to go before the declaration of the end of this outbreak. It's part of the ecosystem in this area where we still have the forest. So it may come back. The good thing is that there are some of the preparedness or response activities that is contributing now to Corona, and it could be also strengthened for the next Ebola outbreak. We don't wish, but it's something that is also probable in this area of Central as well as West Africa, where we still have forests, where we have the normal ecosystem for Ebola. So the actual Corona is taking advantage of system put in place. People train to use protective equipment, people train for screening at the entry point, but this Corona is moving too fast that even all these assets can be easily overstretched by a big number of cases.
And you have said in the past that the health system on the African continent are already very fragile, and you're saying they're also easily overstretched. What lessons, though, have countries like Liberia, like the DRC, learned because of the outbreaks of Ebola that they're able to put in place right now to address this pandemic?
One of the critical lessons is that when you have the communities on board, you can achieve more. Like all this confinement or movement restriction, if you want community to comply, they need fully to be on board. We know that in some of the African settings, mainly in slums, you have many people living in a given household. If these people do not comply to public health measures, it will be difficult to implement it like what we are doing in many Western countries. So it's one of the critical points. The other part that we learn is also that for service continuity, we need actually to have additional or temporary treatment centers. It's what we are having in Ebola, treatment centers set up by the national authorities or by some of the NGO partners. Actually, it will be our key alternative in Africa compared to Europe, like where you have already communicable disease space dedicated unit. In many African countries, few of them do have with very limited capacity. So we hope to count on these temporary treatment centers that for which we are appealing also to donors to support some of the NGOs partners, even national authorities, to prepare already for the mitigation phase that is more than probable many countries.
We'll have to leave it there, but for now, thank you very much for your time, Dr. Michelliao of the World Health Organization. Thank you. There is little doubt that the rapid spread of this virus has shown the lack of international collaboration and global infrastructure to deal with healthcare crises like these. And now, while scientists are hard at work to develop a vaccine, political leaders may be dreaming of an overnight panacea. Their political future depends on it. Ours will depend on long-term investments in the healthcare and well-being of people, with a fundamental shift in national priorities and budgets of governments. From me, Rida Fakhri, and all the team here in Washington, thanks for watching. We'll see you next time.